The population in the local area has changed quite dramatically over the years. Currently has a list size of just under 10,000 patients.
First thing in the morning, it can be very busy when the appointments become available.
General practice are becoming busier and busier.
The NHS is straining at the seams, and the more we can help relieve that and concentrate on what we do best, the good of everybody, and technology's got to be the way forward.
Gone are the days when information was in the doctor's head or on the paper records. That's too slow. It needs to be instant access.
The use of technology enables me to streamline my workload. It has improved the way in which we work.
We have a very fast turnaround, and we also have a target where all clinical workflow is actioned and completed within the working week. Having digitalised records viewable at each consultation would be really helpful for the practice.
Digitisation has freed up a significant amount of space. We've been able to repurpose this space quite easily to create extra desk space for admin staff.
One piece of paper that comes with, say for instance, a clinical discharge could touch 4 different members of the practice, whereas when it's integrated centrally, everyone can comment and action that document, and it's live. It just speeds all the process up.
On a day-to-day basis, I use EMIS. That kind of technology has cut down on the time that I need to enter data, therefore I do spend more time with patients.
On EMIS, there's the little red alarm button in the right-hand corner. Someone collapsed in the waiting room. I simply double-clicked that button and it notified everyone within the building.
Being able to text patients directly from my computer, that's massive. We've got a rapport with them already. The fact that we can text them or email them just makes it far more flexible, and that's brilliant for getting people in for appointments and providing blood results.
The digital signage that we use in the waiting room, we can make that really local. If we've got a flu clinic, we can put it on there. We can really bespoke it for our patients.
And we devise various forms of non-prescriptive medicine, if you like, to help with loneliness, isolation, healthy eating, exercise. So we do walking for health once a week, we have a sing-along once a month. We've got a practice allotment. So from a medical point of view, we know it works.
Our patients and our staff interact together on social media, so they see our reception team as real people, so there's a much better relationship.
Patients were happy with the care they received here, but they wanted to further this more.
Patients have a right to see everything, and that's exactly what we do.
If patients can read our thoughts and what we're thinking about what's going on and what the plan is, they're more likely to follow it.
It's well proven that patients who manage their own health take up fewer resources.
Patient access has been really useful for our practice. There's lots of information that they're able to access to be able to self-help.
Anytime a clinician writes a consultation, that is available to the patient. Anytime a test result comes in, they can see that as well.
We were on holiday in France a few years ago and I have atrial fibrillation, so I downloaded my 2 most recent cardiology letters so that when I went into hospital the next day, I had all my information for the cardiologist at the hospital. It's no point having all this useful information sitting on somebody else's cloud somewhere when we need to be able to use it.
It's a great idea, it's the way of the future, it takes the workload off the staff.
That saves time, it's safer, it's more effective, and it's a quality-based service.
Technology is absolutely crucial now to what we do at surgeries.
I've seen a lot of innovations being put in place, so it's really opened my eyes to what can be done and further change that should be made within general practice to improve the patient experience.